C1 or C2 junction, just like this. And this is going to be my contact point. So I'm going to come up very similar, but now my hand's going to be open. I'm going to come up like that. And then the positioning here, I'm going to actually have the one thing I did forget is I'm going to bring the towel up a little bit higher. The patient's like, what are you doing? And I'm like, that's purposeful. So I'm going to take this hand, I'm going to grasp there, and now the difference is that her elbows are over the target segment. And she's turned away, which pre-tensions that area with the myofascial vector. So it's just like this, come up like that. I make sure that I feel the force at the right area. And for this one, I am going to flex you up, Pilar. Okay. Big breath in, big breath out. Was unsuccessful with that one, but you can get the concept as far as flexing her up and then making sure that I'm shearing one segment versus the next.